Dr. Viengsamay, if you would start. Dr. Viengsamay, feel free to start. Yes, please. Everybody, everyone, I'm grateful to National Nutrition Center and CRS for the invitation to disseminate the research. First, I am Viengsamay Sengchaleun. I'm now working for NUS Public Health Lao program. Our office is located at the medical science institution. My research topic is qualitative methods, and the research is about nutrition and other topics implemented by our office. My presentation today is part of my research paper thesis published last year. The topic is Emergence of National Nutrition Policy in Lao PDR, looking at the collaboration between government and the development partners. First, let me tell you about the definition of malnutrition, and you have known about that. We apply the definition of World Health Organization. Nutrition refers to deficiency, excess, and imbalances of person intake of energy and nutrients. In this topic, we would talk about the undernutrition, the fourth subgroup, which is the wasting. Secondly, is stunting, low height for age, and thirdly is underweight, and fourthly is about micronutrient deficiency. In terms of epidemiology, by 2022, there are about over 149 million, which is 1/5 of children under 5 years old has stunted low height, which is chronic malnutrition. The chronic malnutrition in low-income country represent 34% in comparison to high-income country, which is only 4%. It's observable that the reduction of malnutrition is fast in higher income country. Lao PDR, which is a country with the high prevalence of malnutrition and mortality rate of children under 5 in comparison to neighboring country, which is about almost half is related to malnutrition. The cost of death is related to malnutrition, and the graph shows that the malnutrition of Laos is higher than neighboring countries. Nutrition, chronic nutrition in Laos and distribution is not constant in the red or the dark red, and shows that the prevalent high for the stunting, the chronic malnutrition is very high for some provinces or area, is very high, up to 60 or 70%. And the factors in the area, we can see that the children in rural area had higher malnutrition rate, and the poorest family had higher malnutrition rate. and the education of mother is related to higher malnutrition, and there are differences among the ethnic groups. For some ethnic groups has very high malnutrition. In addressing mitigation of malnutrition in Laos, the concept of nutrition has been initiated in 1990, and so far we didn't talk about malnutrition. In 1992, Laos participated in the international meeting in nutrition, which is the International Conference on Nutrition, the first time organized in Italy. Then Laos government and the development partner had conducted activity or intervention to mitigate malnutrition. And in 1990 up to 2000, there have been minimal progress, not that much. And in the year 2000, the government endorsed the MDG Millennium Development Goal, and Laos is a member, and the MDG content is related to child malnutrition. MDG, if we didn't achieve the indicator 2, 3, 5, 6, 7, it was hard to achieve, and there was MDG progress report to track the progress. There was a study, which is a national study at the national level on the indicators of the health indicator in Laos, and it showed that there were high level of malnutrition, and there were recommendations that to focus only on poverty eradication, that was not enough. To tackle malnutrition or reduce malnutrition, and the report also said that talk about lack of cooperation among multi-sector. Then in 2008, Laos promulgated the national nutrition policies the first time, which acknowledged that nutrition is central in development of the country. And later, there has been national nutrition strategy and plan of action issued in every 5 years. The plan specifies the roles, responsibilities of the related sector in addressing malnutrition. The objective of our research is to explore evolution of coalition involved in fields of malnutrition in Laos before and after, the emergence of the country national nutrition policy in 2008. And the theory of coalition structurally is based on theory of coalition structuring. Coalition refer to person working together, or a network with a purpose to achieve shared goal. This theory, Stumson, classified in 3 factors explaining about the role of the partner. The first one is about transaction person working together in exchange of resources, because they think they would achieve objective, they would not achieve goal if we don't work with other. And the second is intangible factor. It means the organization, with the shared ideology that might happen from former collaboration, former working relationship. And thirdly, it's about control, which is power structure that is used to force actor to work together, participate in the network or coalition. And this is the qualitative study. The data collected is from interview and documents. And data collection conducted in Vientiane capital since March up to June 2020. We interviewed 20 interviewees, respondents, including the respondent participant from the ministries, institution, UN agencies, NGO, and consultancy. The selection of participants based on 4 criteria, including the organization work to address malnutrition, and secondly, is the organization, the person had to work for an organization for at least 1 year, and they have knowledge in involvement of an organization in working in nutrition before and after the emergence of national nutrition policy, and the participation would increase diversity of data opinion. We do semi-structured interview. We have a guideline for the interview, and the participant were asked to draw a diagram that show relationship and cooperation amongst the organization based on their understanding, based on the participant understanding their what have they see, how do they understand about the relationship in anti-malnutrition. They draw about the relationship between them. And the interview conducted at a face-to-face meeting, and also audio recording after receiving consent from participants. Then the document for an analysis is the document written in English, Lao, or French. Since the year 1990, when we did research in 2020 in malnutrition in Laos, and the document were asked from the participants, and we download the document from internet and the websites of the offices of the participants. We, in searching for online document, we have applied keyword, as you can see from the screen, and all of those we have selected 9. We have selected 9 documents for analysis. We have research plan and strategy that tell us about malnutrition and anti-malnutrition and the implementation and what's going on about malnutrition in Laos. In terms of data analysis, we transcribe verbatim, and we talk to the teacher, we talk to the related person, and so that we know what question to improve our question for the next time. With this data analysis for the interview and for the document, we use NVivo software to analyze data, which is thematic and analysis, which is analysis of each topic, each theme. เสียงบ่แจ้งเสียงมาละ we did coding, we read our interview guideline, and we created coding, and we did organization of the interview and combine all data after coding, and we ask participants to draw their relationship collaboration of the participant in anti-malnutrition, and we also did analysis of the diagram using SoftNetV software, which is a free program in analyzing the data. This help visualize the collaboration map, and we look at the criteria based on the discipline of the researcher. For example, we look at the data from various sources, and there are many persons doing data analysis, and after collecting data, analyze data, and we submit the data to some participant, for example, to check, to verify our work. And in terms of results, the relationship has come at this diagram, and the blue is the governmental organization, and the orange is the external partner or development partner, and the circle, there are 3 circles. The first circle is health sector correlation, and the next circle is agriculture and education sector. Before the emergence of national nutrition policy, it showed that there are 3 groups, there are 3 main partners. They work separately, they work in silo, and they somehow have cooperation between health sector and education, Ministry of Education, and they implement the national school health policy accepted and adopted in 2005. But well, the partnership was often limited and specified to only one particular activity. For example, Ministry of Health might visit school when they want to distribute deworming pills, and not much activity, not much significant. And besides, and after the emergence of nutrition policy, many partners have collaborated, have worked together, but it's not, and we have improved the coordination mechanism in 20. There has been a huge change. There has been establishment after having nutrition policy. there have been national nutrition strategy and plan of action, and we participated in the SUN, scaling up nutrition, and there have been national nutrition committee at provincial level, and we have created guidelines for multi-sectoral conversion. And these things happen as a consequence of nutrition policy, and all partners work together for the same purpose, same goal, and all learn the lesson, the experience from each other in mitigation of malnutrition. And it's not just the work of health sector alone. People understand that way. And in comparison to the theory that we have applied, what are the factors that explain about the partner with role to work together, and the outcome, the result, tell that three factors play good role. The importance of control. This explained that after having nutrition policy that enable a coalition, and the transaction factor, for the two before and after, they have similar roles. There have been exchange of lesson, experience, legitimacy, and skill expertise in work, and the intangible factors. It shows that it demonstrates that there have been relationship between individual and organization, institution, and shares ideology and the same vision, and looking the health problem in the same direction, multi-organization working hand in hand or together. So we can say that before the nutrition policy, multi-sector work individually, work in silo without synergy, synergy. The policy involves the related person. There have been delegation of corporate of work, so collaboration has been effective. Before we arrive today, is a long journey for multi-years. And in working together, there have been challenges when multi-sector work together or collaborate. Other countries, among Southeast Asian countries, many countries have applied this model, this pattern. They have faced difficulty for its own country or context. We can say that having national nutrition policy is effective, efficient in involving multi-sector stakeholders to work together to tackle nutrition, because nutrition is complex and complicated, need mutual cooperation. In terms of the limitation of the research, there are three main limitations. Is a semi-structured interview or main data source. When we select the respondents, we base on criteria which might represent some bias that cannot be representative, or that cannot be I'm not sure how can I translate in Lao เป็นตัวแทนถึงแล้ว and I say the national nutrition policy implemented in 2008, and we keep in mind that the participants, the stakeholders have difficulty in recalling the events and were not sure in answering the questions. And we visited them and asked them to verify the response. So we check the response, we verify the response with many sectors. This study does not aim to promote effectiveness of the policy, nutrition policy, but instead it provide perception of key stakeholders working in tackling malnutrition towards the policy. These are recommendations for further research. We might evaluate strengths and weaknesses of the policy or the strategy and plan of action of Laos that might include nutrition surveillance and data quality and resource allocation and budgeting, and also impact of the policy on vulnerable population in malnutrition. And our ongoing project is assessing multi-sectoral coordination in malnutrition. And the results were presented in the National Working Group meeting last month, and there could be study on cost effectiveness of the intervention, and also we want to conduct a study to explore the role of community engagement and activities in nutrition. My presentation has come to an end, and if you have any comment or question, I welcome. Thank you. Thank you, Dr. Viengsamay. If you have any question, and we would upload the document in the chat box, and the video would be downloaded in YouTube ANRCB channel after this seminar. Yes, please, your question and comments. Buddy, I have two questions. Thank you, Dr. Viengsamay, for your presentation. Listening to your presentation, and I have two questions. The first one is about correlation, and in terms of theory for colonialism in terms of determination of policy, strategy is the government that is involved. For example, colonialism in health, public health, and then Ministry of Health, then issue policy, whether is it related to education or community development or agriculture. May I ask, Doctor, what is the difference between structural correlation and structure correlation? And secondly, the participants, the respondent, in your literature review, and it's where it has been for many years, and the participant and the new participant, that is hard. That may be hard for the new respondent to answer the question how it would be consistent to your criteria. I mean, in terms of interview and data collection, there might be some differences. And what method did you use to have access to this global sampling? How did you approach the key informant or the respondents? Thank you. Thank you, Dr. Sanya. Good question. Let me answer your first question in terms of the theory, coalition, and structuralism. I haven't heard about the structuralism in this, but in conducting research, if we rely on a particular theory, the results, I believe, would be along with the theory we used. So we selected the theory that is consistent to our as much as possible. That is the reason of my selection of theory. I apply this research used one theory. The former research used three theories. I consider factor, many factor, and I thought I want to try the objective because it's related to our research topic. And it's also related to coalition. That study explore use of strategy of development partner in order to influence Lao government to develop nutrition policy and to respond it. The responses. And yes, we receive different results, but use of we not exactly based on the exact theory because the country originated the theory based on the context, which is different from our context. So we did some adaptation to make it more contextualized. The second question is a crucial question in terms of approaching the respondents. We use purposeful sampling based on the criteria I mentioned. I have a concern on whom that would be able to respond, so we select the experience and senior respondent in working with nutrition. The supervisor were teacher Sengchaleun, and he had connection. The person had connection, so they advised that they refer to other respondent in a snowball sampling. We contacted 40, 50 respondent international partner and Laotian who have experience working in malnutrition. We send emails. Many persons responded and accepted. Many of them were not available because it was the start of COVID-19, March 2020. And many respondents want to participate, but it's hard to physically approach, and it was suspended. But anyhow, we collected self-sufficient data, and we collect the same data again and again. So we felt that our data were reliable. I have seen you in vivo. You selected two methods for doing analysis. In vivo is not the only single method that I apply. At that time, I learned about the use of in vivo, and the software is costly, and luckily we were financially supported, and in vivo analyzed the data in messages document or the interview message, the interview content, and we also use SoftNet software with helper analyze data related to a particular person or a network, and it shows a result as a diagram like this, and the text and for the text we use in vivo to produce text and messages. And this diagram, we ask the respondent to draw their understanding, their perception in how did the stakeholder working together. For example, UNICEF work with whom, which partner, Ministry of Health work with whom, which counterpart, and they draw based on their understanding. Thank you, doctor. Thank you, doctor. What about other participants? I am Thong Chan from Army Association. Much appreciated to your presentation. We gave it important data, which is the same as me. I'm now doing my thesis, my master degree, and I have selected a topic in nutrition similarly, and focusing on child malnutrition. So when we collect data, would you provide suggestion when I collect data, how can I ensure good data quality? So what factor to to pay attention, right? Is that your question? Because of the signal problem. Dr. Thongchan, do you hear me? Yes, and he seemed to lose connection. Well, I'm not sure is the qualitative or quantitative that you do with your thesis. Dr. Thongchan seemed to get lost of connection. Dr. Thongchan from Army. เน็ตเพิ่นหลุดไปละท่านทองจันทร์รอท่าเพิ่นเข้ามาใหม่ก็จะมีให้ถามท่านทองจันทร์บ่ว่าเพิ่นได้ยินบ่เห็นเพิ่นอยู่Brother Thongchan, do you hear it? Do you hear it, Brother Thongchan? I Thongchan, do you hear us? We might go to other person question first and come back. อาจจะไปคำถามอื่นแล้วกลับมาก็ได้บ่In terms of data collection, thing to keep in mind, thing to pay attention to in terms of qualitative data is quite challenging. Our question might be too short or too long, and the respondent might just say yes or no answer, and we want to train to enumerator for them to understand the objective and the goal before we collect data. When we collect data, when we interview, we want to review what else are missing, what else are missing, what are strength, what are useful data. If possible, we want to disaggregate the data from the beginning. We want to classify the data in the beginning, because when we ask the question, some respondents only give short response, and we want to give a probe question to stimulate more responses, more answer, and some too long answer are abstract, not consistent, and we want to be quick and the objective in our head, and we want to be on track on the objective and get back to the point. Not sure if I can answer your question, Brother Thongchan. ว่าแล้ว Doctor, if you would briefly summarize 1, 2, 3. Is it qualitative or quantitative? I think it's qualitative. You want to be clear with your objective. Secondly, the question should be well trained to enumerate to you you want to be much familiar with your own question and objective, and you want to encourage the participant to speak more. And you want to use the sub-question. You want to be quick, familiar with your question. And importantly, if it's the first time interview, you might feel you didn't do good, but the second and the third time you would feel better. You would feel familiar. Thank you so much. Can you hear me, Dr. Suk? Thank you, your presentation, which is helpful. I'm Suk Sawan. I'm from Mother and Child Health Center. I'd like to ask you, do you have the number, the statistic of children malnutrition rate of malnutrition in your research, the number? I mean, the first thing. Secondly, you said that the data cannot represent the national level. And how about if we would do research based on your problem, and we would want to focus on few topic problems, and can we use data from your research as a reference, as an official reference? Thank you. To the question, the first question on the mortality rate of children from malnutrition, our research didn't incorporate or include such number or such figures. But we have the mortality rate of children in relation to malnutrition, which is 45% of children under 5 with malnutrition. The second question, representation of the research results. In research principle, qualitative research, it doesn't aim for representation or being representative, but the objective is for the research that have not been conducted before. And representative, is it effective? It's the representative of the theme of the emergence of national nutrition policy. For this reason, can be used as an official reference, and there might be some results that are linked to your research. And the data here can be used for you as references. Many thanks, Doctor. Do we have any other points? I'm still interested to talk to you more. There are a question in the chat box from Viengsamay Sengchaleun. In Lao PDR, the percentage of malnutrition in Lao PDR, how much? And the latest data collection based on the latest data collection, the percentage of malnutrition in Laos is over here. Based on related analysis, 2023, the malnutrition for stunting, the blue, in Laos is 33%. And the malnutrition, the wasting, is 11%. And the underweight malnutrition is 24%, if I recall correctly. This is the 3 types of malnutrition. Well, there might be no more question, haven't seen in the chat box. So, I'm much thankful to Dr. Viengsamay and the director of Nutrition Center is busy. She's having an ASEAN conference, and I would request all distinguished guests, I would ask, oh, there is this another question in the chat box. But let me answer the question. The causes of malnutrition are substantial based on the data from UNICEF. Making a diagram, and it starts the basic course. The basic course starts from the policy, socio-economic status, the context of the country, and then underlying causes would include at the next level is related to the causes. The causes could be because of access to health services and the knowledge or the practices in feeding children, in nurturing children, and the mother education level. That impact, that affect the malnutrition. And in terms of direct causes, could include the consumption, food consumption in insufficient manner is the diet or the food, or it can be because of the disease that make people malnutritious. Also, My pleasure. Do we have any more discussion points, questions? Otherwise, if you don't have any further points, I apologize that the director of the nutrition center has left us for a meeting, and I would ask everyone offline and online nutrition center and ANRCB project. I'm thankful to all participants for your participation to the seminar, and I appreciate to Dr. Viengsamay for chairing the Emergence of National Nutrition Policy in Laos. I hope all participants learn the important lesson, and you can look at the video at the ANRCB YouTube channel. And we conduct a seminar every month, the first week of the month. And I wish everyone healthy, successful in your work. And I'd like to close the seminar officially. Thank you, Dr. Viengsamay. This is already the final PPT. Feel free to share the PPT. And I will ask to share your contact and the PPT. Thank you, Sister Viengsamay.